Hello, my name is Dr. Ruchir Patel. I'm a fellowship-trained and board-certified sleep medicine physician, and today we're going to discuss the topic of restless leg syndrome and another condition that can often be related called periodic limb movement disorder, or PLMD. Restless leg syndrome is actually a condition where individuals in the evenings, whether they're watching TV or relaxing or trying to go to sleep laying in bed, they may feel pain or discomfort in their lower extremities or their legs, or even an internal sensation of anxiousness that causes them to have to move to be able to alleviate those symptoms. As soon as they stop moving, those symptoms may return again. So for some individuals, they end up chasing after these symptoms, and that causes them to have a hard time falling asleep. So that's restless leg syndrome. Restless leg syndrome is not having just spontaneous jerks of your lower legs or your feet, or even kicking when you're sleeping. Restless leg syndrome, also known as Willis-Ekbom Syndrome, technically can affect any part of the body. It's most common in the lower half of the body, in the legs, but it can affect the arms, it can occur in the abdominal muscles, it can even occur in the neck. Now, periodic limb movement disorder, which can often coexist with restless leg syndrome, is a condition that occurs after you've fallen asleep. This condition involves involuntary movements of your feet or your legs in a flexion type movement where it can sometimes individually trigger the brain to wake up. So it can be a source of disrupting sleep, but it can also be a source of causing a person not to get good quality sleep that can cause him or her to feel tired the next day. A common symptom of periodic limb movement disorder is waking up frequently with cramps or charley horses in your lower legs, but some people will even notice that where their heels lay on the bed sheets, that they may have worn them out, and that's because of that repetitive movement that happens with this condition. So diagnosis of restless leg syndrome is not done by a sleep study. It's actually done by meeting with a sleep physician, and you have to meet at least 4 out of 5 clinical criteria, and it's a clinical diagnosis. It does not require a sleep study for diagnosis. Potential things that would be evaluated when you're diagnosed with restless leg syndrome would be checking a blood test called ferritin, which is the long-term marker of iron storage. If your iron stores are low, that can reduce the production of dopamine, which in turn can cause restless leg syndrome to develop. Then also you want to consider if you have diabetes, if you have peripheral neuropathy, any kind of lower back injury that could be causing nerve compression, which may also cause restless leg syndrome. Also want to make sure that you're not exposing yourself to various different things that may aggravate restless leg syndrome, such as nicotine or alcohol, peppermints, even sleep deprivation. But even untreated sleep apnea can often be associated with restless leg syndrome, and if it's not identified or treated, it can greatly aggravate restless leg syndrome. For periodic limb movement disorder, this condition has to be diagnosed via a sleep study, where you go into a sleep center and spend the night where you're connected to a bunch of electrodes, including electrodes on the legs, that monitor to see if your legs kick or flex in a very specific manner and if it triggers the brain to wake up. We calculate the frequency at which the movements occur, plus the frequency at which the movements trigger the brain to wake up, and if you meet the minimum threshold, then you may be diagnosed with periodic limb movement disorder. And further evaluation for this condition is similar to restless leg syndrome, including checking a ferritin level in addition to reviewing other risk factors or aggravators such as nicotine exposure, alcohol, or sleep deprivation. Treatment for both of these conditions, if it's unrelated to low iron stores, could be medication therapy, and that's something that you would have to discuss further with your sleep physician in terms of potential treatment options.